Dr. Mike here. Today we're going to look at a case of cervicogenic vertigo. This patient developed vertigo after turning her head, her neck cracked, and her arm went numb, and the vertigo has been getting worse over the last couple of months. So we're going to show you how we put it all together with static x-ray and motion x-ray. So the motion x-ray is going to show us the function, and the static x-rays are going to show us the alignment. So if we start with this first x-ray, there's going to be some clues as to where the problem's at. So we draw lines on all the vertebra, and we're going to notice from T12 all the way up to about C4, all the vertebrae are pretty lined up and pretty level. And as soon as we get to C3 and C2, there's an immediate kinking to the left. So we want to explore this area to see if there's a problem here. And then we also want to figure out what is the skull doing relative to the atlas bone and the atlas bone doing relative to the C2 in this static position. So that's where we're going to rely on the upper cervical x-rays to try to put everything together. So we're going to watch the motion x-ray and see how the C2 and C3 are functioning. And we're going to see that when she bends to the right, her C2 doesn't move very good, but when she bends left, it bends really good. So we can watch that one more time. She bends right. The C2 doesn't move very good at all, but she bends left and it bends really good that way. So we know that C2 and C3 cannot bend to the right. And then if we look at the upper cervical x-ray, we have a program that measures how the skull is sitting in space, how the atlas is sitting in space, and then what the lower neck is doing. We're going to see that her skull is tilting into her atlas to the right 3.76 degrees. So her vestibular system is getting conflicting information. The skull and the C1 joint are tilting to the right, but the C2 and the C3 are tilting left. And then her eyes are kind of tilting to the left in her ears. So her brain's trying to measure all this input from all the joints and the eyes and the ears, and it's trying to maintain you in space. And when it gets this lack of proprioception from dysfunctional movement, and it gets aberrant input from misalignments, it just can't coordinate properly. So we did a few adjustments, and we focused on the C2. So there it was again, bending to the right and then the left. So we focused on the C2 and the C3, and then we're going to watch a follow-up motion x-ray, and we're going to see that's bending much better to the right. It's actually bending a little bit better to the left as well. And then the spinous is going to come back a little more to the center in neutral, and we're working the atlas down. And in 4 weeks, her vertigo is about 80% better, and she also had some neck pain associated with that, and that's improving as well.